CloudClinic was formed. It was actually a very interesting story. I was taking my son to the hospital, and it was supposed to be just for a checkup. But then I ended up spending about 3 hours in traffic. You know how Lagos here can be. And then I started asking myself, why does it have to be this difficult to be able to get to hospital, to get access to healthcare? And then I remembered that this is something that I've a while ago had come up with some form of work around that, about 8 years before then. So I figured, there has to be a way to do this. There has to be a better way than having people queue up in traffic to go get access to healthcare. So that's really how the whole thing started. From that point on, I knew that figured out something has to be done about this. And then I did some research, looked around the people trying to do this kind of work, and figured out there was something different that we have to do. We definitely have something that we can do to make that a reality, and the rest is history. The key thing that we are doing in CloudClinic is that we're comparing ourselves from how we are today to how we are yesterday. That's really the biggest metrics for us. We're very much aware that there are other players in the industry, and these guys are doing great and excellent work. But CloudClinic has a clear vision. And our vision is to provide convenient access to healthcare for everyone, everywhere in Nigeria. And there is nobody that has exact same vision. So even as much as we are always looking at what is happening out there and what else is outside there, we know that we have to make sure that we're improving every day. So how we differentiate ourselves is that when we look back and say, are we better than we are yesterday, today, then it means that we're heading forward. That's our biggest asset. We have a couple of patents already that CloudClinic has is proud to say that we've introduced. One of the key things that we've done is a CloudClinic sponsorship portal, which is really completely transforming how sponsors can sponsor healthcare in Nigeria. We've done a lot of work with artificial intelligence in this solution, and we've built something that we believe every HMO, health insurance agencies, would want to get their hands on. And we have a couple of conversations that are about to close out pretty soon. So I think that's definitely one of the key things that we've built. But we've also built some really intelligent solutions within my CloudClinic app itself. So a key one of them is the feature that makes it easy for a patient or a user to find a hospital close to him. And the way we do that is when a doctor is consulting with the patient on CloudClinic, the doctor is able to prescribe the right drug based on with the patient location and the pharmacies that are close to that patient on inventory of those pharmacies. And these are patented technologies that we have received the patents on. We've been able to do a lot of work around the payment. It's a lot of payment innovations as well. So, innovations around offline payments that will make it easy for anybody on our platform, on our network, to be able to receive payment from any patient anywhere in Nigeria. And similar things like that. The list is endless. I would invite you to visit our website, and then you would find a lot more information about some of the features of CloudClinic. We have strategic partnerships with different healthcare provider companies, pharmacies, med labs, different hospitals, different healthcare agencies within government, the regulatory agencies for both medical doctors, for med labs as well. So we've been forging this relationship because we understand that this is not something that we're going to do alone. We need all of these bodies to work together to deliver the kind of vision that we have to provide quality healthcare for everyone, everywhere in Nigeria.